Well, this is Dr. John Wycoff, and welcome to Pathway to Wellness. This podcast is designed to help you get on that path to improving your health and wellness, and we're always looking for natural ways to get you on that pathway. I think that one of the issues with modern medicine is that physicians have gotten so used to prescribing medications. That's really the only tool that they have in their toolbox to help you improve your health. And really what we find, especially with people with chronic disease has gone on for months or years, and that's really what we deal with at Wycoff Wellness in East Lansing, is chronic illness. How can we empower you as a patient to really understand your disease, your symptoms, and what you can do about it, whether it's changing your diet, changing lifestyle, looking at stress and sleep, things like this, looking at supplementation, looking at what medications you take and do you really need them, and is there a different way to approach that problem? Whether it's high blood pressure, diabetes, heart disease, cancer, hormone imbalance, anxiety, insomnia, ADHD, bipolar problems, anxiety, depression. Oftentimes there are root causes that you just need to have someone help you find those reasons. And that's really what we do at Wycoff Wellness. So today's talk is about lab tests that you need. And I know that many of you have gone to your primary care doctor and they've done their laboratory analysis, and they are saying, listen, everything looks really good. Your tests look fine. And usually the discussion ends at that point, especially if you look healthy. And this happens to me every day in my practice. I'll see a healthy 40 to 50, 60-year-old male or woman, man or woman, and they look great, but they have symptoms like fatigue. I saw a young lady last week. She was just exhausted. She'd been exhausted for decades. Yet every time she went to the doctor, they told her nothing was wrong. She looked fine. She was married. She had a job. She had 2 kids. Didn't have a lot of stressors in her life. She slept fine at night. She had a normal sleep study. They did some blood work and patted her on the back and said, listen, Lori, you're fine. You're probably just under some stress. Well, Lori finally took the first step to getting healthy and called our office and set up her initial comprehensive consultation where we went through her history, went through her testing, and then outlined a plan step by step to get her going in a pathway to wellness. And that's what we do at Wycoff Wellness. So what I've broken the talk down today is really into 3 sections. One are routine blood tests, things that you need to have done and that your doctor is probably doing right now. Some of the limitations, how to interpret those results optimally, and what tests you can ask for on a routine basis that can help you go maybe further with your primary care doctor. Then we're going to go into a section I'm going to call biomedical testing. This is really more in my world. This is more specific testing to try to get to root cause or causes of your health issues. Very simple testing. And not terribly expensive. People say, oh my gosh, I'm going to spend tens of thousands of dollars. That's just not the case. We're talking a few $100s to get these tests, and maybe your insurance will cover them. And then the third section we're going to talk about will kind of go in with our methylation podcast from a couple weeks ago, genetic testing. We'll spend just a little bit of time touching on that again. And if you go back and look at the methylation podcast, you'll see much more information about that type of testing. So let's get started. And if you have questions, you can always contact us at Wycoff Wellness. We're at 1226 Michigan Avenue in East Lansing, 517-333-7270, 7270, or find out more at wycoffwellness.com. We're always here to serve you. My staff's very knowledgeable, educated about the test options, and can help guide you down that path. So let's say that you go in for your physical or you go in with some complaint. Your doctor says, let's get some testing. Well, that testing will probably be comprised of a complete blood count, CBC, a chemistry panel, sometimes called a comprehensive metabolic panel, maybe a thyroid test called a TSH. And that'll be the majority of what they're going to get. And what they're going to show you is they're going to show you that you don't have anemia or a bone marrow problem with your blood count. And those are important things. And certainly an anemia, a low iron level causing an anemia, a low B12 level causing an anemia would cause fatigue. So it's of some value. The metabolic panel looks at your kidney function, liver function, your blood sugar, your electrolytes. And again, these are tests that are of some value to you. If you're taking medications, they should be checked. But again, the predictive value of that test for most symptoms is minimal. They're worth doing, but again, they seldom show us anything. The value of like kidney function tests, liver function tests, those are end-stage abnormal results. If they're abnormal, you're at the end stage of kidney or liver issues. They don't tell you that you're suffering from some stressed out liver or some detoxification problem through your liver. That just says your liver enzymes are normal, your kidney enzymes are normal. Same way with electrolytes and even blood sugar with diabetes. And then TSH, a thyroid-stimulating hormone, tells us about how your pituitary gland is working. It really doesn't tell us anything about how much thyroid hormone you're producing, and certainly low thyroid, and we're going to talk about that in an upcoming podcast, hypothyroidism, the hidden disease, or maybe it is your thyroid. I encourage you to listen to that right here wherever you're listening to our podcast. That'll be upcoming shortly. Can really put you on a different pathway of evaluating your thyroid. So let's talk a little bit first in the realm of these routine tests. On a CBC, oftentimes you'll see something called an MCV or MCHC. They may be high or low. Your doctor probably will just gloss over that. But those are indications of iron levels, B12 levels, and folate. If they're abnormal, there should be a reason. Ask your doctor why they're abnormal. They can be subtle clues as to why you're having a myriad of health issues. On your metabolic panel, look at your fasting blood sugar. If it's in the borderline range between 100 and 126, that's the prediabetes or glucose intolerance, metabolic syndrome, insulin resistance, whatever term you want to use range. Talk to your doctor about that. I would go further based just on an elevated blood sugar, even a high normal blood sugar, and get a couple additional routine blood tests, very simple tests. One's called a hemoglobin A1C. That's your average blood sugar for the last 90 days. It should be below 6, ideally below 5.5, maybe around 5.2. If it's above that level, then you're at least showing a trend towards insulin resistance. That oftentimes presents with fatigue, trouble losing weight, especially around your belly. Ask for a fasting insulin level. Again, this is a great test as a predictor that you may develop diabetes. And really, when you're having a test on any test, you want a test with some positive predictive value. That's really what you're asking for. You want to know not only how healthy you are today, but is there something in your blood work that shows that there may be a problem a year from now, 5 years from now? Fasting blood sugar, HbA1c, fasting insulin will help you do that. So ask for those tests. They're very, very inexpensive. They're on all routine laboratory test requisitions. Your doctor can get them and should be able to help you interpret them. I'd like to see the fasting blood sugar ideally actually at 90 or lower. 92, 94 is okay, but if it's getting up to 96, 98, although it's normal, it is trending towards becoming borderline high. So look at the fasting blood sugar and then get a hemoglobin A1C fasting insulin level. That's all you need to tell you if you're on that road to insulin resistance. We're going to have an upcoming podcast on Pathway to Wellness about insulin resistance. This is such a big deal for people that struggle to lose weight, have increased weight around their belly. Maybe they have obesity and they just cannot lose weight no matter how they structure their eating and exercise. Insulin resistance can be the clue in treating it to unlock weight loss long-term for you. And then your TSH. So the doctor will get a TSH, and it has a normal range from around 0.5 to 4.5 or 5. That's a 20-fold difference from low to high. Now, remember with TSH, this is an inverse relationship. A low TSH means you're hyperthyroid. Your thyroid's overactive. The higher the TSH, the more underactive your thyroid is, the more hypothyroid you are. So let's say your TSH levels comes back at 3.5. That's well within the range of 0.5 to 4.5 or 5.0. Your doctor says, oh, it's normal. But you say, well, doctor, I'm tired, and I have dry skin, and I'm constipated, and I'm losing hair, and I just don't feel right. Maybe it is your thyroid. Well, really, that range that they're using as normal is a statistical normal for a big population. Even the American Academy of Endocrinology has gone on record saying that the high level of TSH should be no higher than 3.0, not 4.5, 5.5, 5.0. So even if you were to bring that level down to a high normal of 3.0, then that 3.5 level you have would be high, and you would be hypothyroid. At Wycoff Wellness, we try not to treat the lab test. We try to treat the patient. So if you're a patient at Wycoff Wellness and your TSH is above 3, clearly I'm looking to treat you if you have symptoms of hypothyroidism, fatigue, weight gain, brain fog, hormonal imbalance, constipation, dry skin, dry nails, hair loss. Those would all be common symptoms. Feeling cold. Your hands and feet are cold all the time. Common symptoms of low thyroid. If you have those and your TSH is even borderline high, we're going to address it and talk about it. But really, when you get a thyroid panel, your doctor should get the other thyroid hormones. That's a free and total T3, free and total T4, and the 2 thyroid antibodies, antimicrosomal antibody and antithyroglobulin antibody. That's a complete thyroid panel. Inexpensive. Any routine lab can obtain these tests for you. I'll list them again. TSH, thyroid stimulating hormone, free and total T3, free and total T4, just the initial T, the number 3, the number 4, antimicrosomal, MICROSOMAL antibodies, and antithyroglobulin antibody, THYROGLOBIN antibody. Your doctor will know these tests. They're routine tests that they're aware of and they get from time to time. The antibodies are important because they're seen in autoimmune types of thyroid disease, such as Graves' disease, which is hyperthyroidism of an autoimmune nature, or Hashimoto's thyroiditis, which is the most common cause of low thyroid in women. Underfunctioning thyroid with thyroid antibodies is Hashimoto's disease. And there are nuances as to how you treat those diseases. So get the right routine test. In the realm of other routine tests that I think are valuable, I would ask for a serum B12 level. A low B12 level is almost always indicated or indicative of a methylation defect. We'll talk about that more later in the program. Easy test to get, B12. Get a vitamin D level, get a cholesterol level. Your doctor may have done those as part of your routine test, and that's good. Looking at those levels, we'll talk more about the lipid panel in the future, or today, when we talk about biomedical testing. And ask for a magnesium level, maybe a zinc level. These are also help you with insulin resistance and metabolic syndrome, along with genetic issues. The other test that frequently it's just not done is a homocysteine level. Maybe the single most important test you should ask for. Just a few dollars, your insurance will cover it. Homocysteine level, if it's elevated above 10, almost always indicates a significant metabolic genetic issue. We'll talk about genetic testing towards the end of the program, so keep that in mind. But a simple screening test you can get and you can use to follow methylation, that genetic barrier to health, is a homocysteine level. Also, a C-reactive protein called a CRP is another inflammatory test which is worth obtaining from time to time and monitoring. Oftentimes, following these tests over time is more helpful than any one individual test. So if you can track these yourself at home, put together a little graph or spreadsheet, or oftentimes the lab where you have the blood drawn will have a portal you can access, and it will show your test over time. I'll be very honest, the way tests track over time is much more important to me, and if you can help me by either tracking them yourselves or showing me a printout of the last 5 years, 10 years, what your TSH has done, what your blood count has done, what your blood sugar has done, that can really help the clinician make the decisions you need to optimize your health and wellness. And don't be afraid to get on the internet and research what these tests mean. If you just go to Google and put, what is an MCHC? What does it mean? Elevated or low? You'll find some information that can be very helpful to you. What does a high homocysteine level indicate? So take charge of your health. Be willing and to ask questions of your clinicians. Have them explain those tests to you. Okay, so those are the routine tests you can get in any lab, any doctor, any primary care doctor can order those tests for you. We get those almost on every one of our patients. A CBC, metabolic panel, lipid panel, D3 level, B12 level, complete thyroid level panel, all the tests we talked about, TSH free and total T3, T4, thyroid antibodies. I usually get a sedimentation rate as another measure of inflammation. Easy tests to get. Homocysteine, magnesium, zinc, and fasting insulin, hemoglobin A1C, CRP. Easy tests to obtain. You may have noticed I didn't mention other hormone tests. Well, your history and physical may indicate that you need other testing, but in my world, we do a lot of hormone testing, but I'll put that in the realm of biomedical testing. We do testing that involves using saliva as the vehicle to measure the hormone levels. I think it's a much easier and accurate way to get hormone levels that have some meaning. You spit into a tube and some morning at home, you collect it, and you send the tube in a little prepackaged container. Relatively inexpensive. Men and women can do this. We can check a number of hormones. We can check your female or male sex hormones. Estrogen, there's 3 of them. Estrogen, estradiol, estriol, estrone, progesterone, testosterone. We can check your adrenal hormones, DHEA, and cortisol. Cortisol, we normally will get those collect during a 4-vial collection throughout the day, morning and noon, late afternoon, bedtime. And we would show you how to collect those and how to submit that the same exact way as the 1-vial saliva. So at Wycoff Wellness, we make the decision on to which panel or which test we're going to obtain at the time of your initial visit. Your history and physical will indicate which testing will be most help to us. But a saliva hormone test can be invaluable to get you on the right path to a wellness. We use ZRD laboratory, but there are other ones out there. There's a Dutch test, and there are other saliva companies. I think they're all relatively good. We just have a level of comfort, and we've used ZRT laboratory for years, so we're familiar with their panels. I know they're a reputable company, always trying to improve, and we trust the results we get from them. So at Wycoff Wellness in East Lansing, ZRT laboratory saliva testing. Other biomedical testing, we have a myriad of things. You know, part of what makes functional medicine different is that we integrate the good with conventional with alternative treatments. So my toolbox of testing is much greater than what your primary care doctor will get. Not only do we do saliva testing, we also can do lipoprotein particle analysis of your cholesterol, get your good and bad cholesterol, but we can get the subfractions, the size of the particles. Very important if you want to understand your risk of cholesterol as it relates to heart disease. I think especially if you're looking at going on a statin drug, you should always get a lipoprotein particle analysis test if you've had a family history of heart disease, especially premature heart disease. Someone in your family before age 50 suffered a heart attack or died of a heart-related disease. An LPP test, lipoprotein particle test, can be done, and they're about $100, really inexpensive. Beyond this, we have a number of other tests that we can do. We have certain tests related to autism, which can involve things like heavy metals, organic acids. We do those often. We also can obtain testing on stool samples if you're having digestive problems. A digestive stool analysis can be very, very helpful. We have unique allergy testing, blood testing that can check for hundreds of foods, pollens, molds, much more than your typical skin test can do, and it's just one blood poke. We get the IgG and the IgE antibodies to foods, and that can really help us understand how you're reacting to what you're eating, look at avoidance, or look at a treatment like low-dose allergy immunotherapy, LDA, which is something we do frequently at Wycoff Wellness in East Lansing. So there's a variety of biomedical testing. We also work with a lab called Cyrex Labs, Cyrex. You can get on their website at www.cyrexlabs.com. They offer a number of arrays or blood panels that look at things like leaky gut syndrome, food allergies, gluten issues. Again, this can be invaluable testing depending on what you're looking for and what your history and physical maybe is leading us down that path. So on the pathway to wellness, oftentimes you've got to get the right test. Once you've got the results, you can look up the treatment. It's not hard. We also do micronutrient tests. This is a test where the level of 33 key nutrients inside your cells. Very, very invaluable test. I do it once a year on me, and it helps me fine-tune my supplement needs. I always tell people that we try to supplement your deficiencies by the testing that we do. We identify the deficiencies. We can't get all the testing for blood levels of B vitamins and antioxidants and minerals out of a routine blood draw at your lab, so we do the biomedical testing. The one we use is from SpectraCell Laboratories. If you go on their website, SpectraCellLaboratories.com, you'll see the methodology that they used for this testing. They do a number of tests, but the micronutrient test is a big test for them. They also do the lipoprotein particle profile, the LPP test. So those are easy tests that you can do. They're relatively inexpensive. And we have other biomedical tests based on your specific needs, such as heavy metals. If you're concerned about heavy metals, we can do a provoked urine test and look at whether or not you have a high level of heavy metals in your body. We can pull that out with a chelator. We'll talk about heavy metals in an upcoming episode of Pathway to Wellness when we talk about chelation and heavy metal toxicity. So suffice it to say, there are tests that can be done, and oftentimes they will help us. So that's kind of a nutshell overview of biomedical testing. The last testing we're going to talk about just briefly is genetic testing. Genetic testing that we do at Wycoff Wellness is to look at methylation barriers. I'd encourage you to listen to our podcast on methylation because it will help set the backdrop for what methylation is. Methylation is really transforming a nutrient, a toxin, into a form that you can use for energy or you can eliminate. And our body does methylation millions of times a day. Our cells do that, and in your DNA locked in your methylation pathway at conception. So when mom and dad's egg and spermatozoa hooked up, your die was cast. Your genetic makeup was formed at that point in time, and we live with that the rest of our life. So we can measure the methylation genes. There's just 5 of them. The big 2 are MT, HFR, and COMT. But there's MT, RR, MH1A, SBHT, CBS. There's some other methylation genes. We can get an entire panel. It's a blood test and a swab from your cheek. We obtain it in our office. Right now, it's $378. It's a test you have done just once in your life. Your genes never change, but can really get us to the root cause of chronic health issues, bowel issues, sleep issues, anxiety issues, because of the ability of your body to get rid of neurotransmitters, neurochemicals, is critical in whether you have anxiety, depression, bipolar disease, insomnia. If you've got any of those types of problems, we really would like to know what your genetic makeup is. If we can identify the genes that are abnormal, we can help you support those genes very specifically with avoiding certain foods, eating more of other foods, taking the right supplements. So that is a really critical test for chronic illness. It is the methylation genetic test. We do it through Genova Diagnostics, the methylation panel. You can hop on their website. Just Google Genova Diagnostics methylation panel and learn about it. A relatively inexpensive test. Do it once in your lifetime and find out how well you methylate, how well you make energy, how well you get rid of toxins, detoxify. Well, that is a lot of information in a short time. I hope that you find it helpful. We are always available at Wycoff Wellness in East Lansing. You can either call us, stop by, or get a hold of us electronically. Our email address, our website is wycoffwellness.com, WYCOFF wellness.com. We're located at 1226 Michigan Avenue in East Lansing. We're just west of the Harrison Roadhouse or east of Frandor, right off of 127. You can call us at 517-333-7270, 333-7270, or 800-471-0255. My staff is well-versed in all of this, and they can help you learn about what we do at Wycoff Wellness. It would be a privilege to see you as a guest. We really call our patients guests because we feel like we're inviting you into our office and we're here to serve you. That's what we're about at Wycoff Wellness. So if we can be of service to you, please give us a call, learn more about us, and let's get you on that pathway to wellness. Keep listening. We've got more great information upcoming.
The information provided in this podcast is meant to be informative and educational only. It is not intended to be specific medical advice. Dr. Wycoff suggests you discuss any of this information with your personal medical practitioner before beginning or changing any form of treatment.